Hi, my name is Emily DeShong, and today I will be telling you about a study done by Sutherland, Pierce, Blomqvist, and Honda. It was published in Maternal Child Health in 2011, and it was studying breastfeeding practices among the first-time mothers and across multiple pregnancies. They originally found a problem when they realized that 74% of U.S. infants are breastfed, and they said that if they could increase that number to even only 90%, that the U.S. could save $13 billion annually. So the purpose of this study was to examine breastfeeding patterns of initiation among multiple pregnancies and with demographic and obstetric characteristics of each pregnancy. There was no specific literature review section in this article. However, they did note that former literature has noted that a low percentage of women are breastfeeding in the U.S., and they would like to determine why. There was no theory, model, or framework used in this study. They had two hypotheses. The first was that the breastfeeding initiation rates will remain the same across multiple pregnancies, meaning the breastfeeding rate in women who have one child will remain the same throughout their second and third pregnancies, etc. And the second hypothesis was that there will be differences in the demographic and obstetric data and the breastfeeding patterns. Specifically, they were looking at the differences between cesarean and vaginal deliveries. There was no independent or dependent variables, as there was no interventions given. The research variables studied the vaginal and cesarean deliveries, birth weight, spontaneous or induced labor, the presence of third or fourth degree lacerations, operational assisted deliveries such as forceps or vacuum, postpartum complications such as maternal readmission to the hospital or uterine infection, and the breastfeeding attempts and successes. The study also looked at demographic data of the women, including maternal age, race, and education. This was a correlational longitudinal cohort study. There were no interventions given, and there were two different group assignments given. So the first was in the vaginal deliveries. They assigned maternal age assignments in 5-year strata. And then they also assigned each woman to the time between delivery in quarter years. This was a random sample originally from the Mother's Outcomes After Delivery study, the MOAD, which was being conducted in Baltimore at the time of this study. And they pulled from these women to randomly accumulate a 3:2 ratio of cesarean to vaginal births, since this is what the study was specifically looking at. And they subdivided the vaginal group into age, as previously stated. And the final data used 812 women from the study. It was calculated that they had an acceptance rate of 80.9%. That was not specifically stated in the study, however, and also calculated was a 5.4% attrition rate. They included women who had had their first child at the Greater Baltimore Medical Center 5 to 10 years before the enrollment started for this study, and they excluded many different aspects of women. So the first was if their index pregnancy, the first pregnancy that the study was monitoring, was a maternal age extreme, so lower than 15 or higher than 40. And then other factors such as a premature birth, placenta previa, multiple gestations, fetal abnormalities, if the baby was a stillbirth, if there was a prior myomectomy, or placental abruption. They also excluded a smaller group of women if they were pregnant at the time of the study, if they had had a child or pelvic surgery 6 months prior to the study, or were unable to complete the questionnaire in English. This study was approved by the Greater Baltimore Medical Center as well as Johns Hopkins University, and each participant was given a written consent form. Although not explicitly stated, the questionnaires were mailed to their homes, so it was assumed that the study was completed, or the questionnaires were completed at their homes. The questionnaires were developed by the researchers. The one on breastfeeding practices was a modified NIH study developed by the researchers, and the demographic data was a questionnaire developed by the researchers as well. First, the researchers looked at hospital records to determine if the women fell into their categories and inclusion and exclusion criteria. And then they made phone call interviews to each of the patients to determine if their hospital records were accurate. And then they grouped the patients through random assignment, so again, the 3:2 vaginal, cesarean to vaginal ratio. The data was then looked at to determine, was analyzed using many different types of analysis. The first was the common variables were analyzed using median and interquartile range. The categorical variables were analyzed using percent and frequency. The clinical characteristics were analyzed using the Kruskal-Wallis method. The categorical variables across groups were analyzed using chi-squared, and the regression analysis was used to account for the retrospective aspect of the study. The study found that women who were unsuccessful in their first breastfeeding attempts were less likely to attempt to breastfeed in their subsequent pregnancies. They did not find any significant difference between cesarean and vaginal deliveries, but they did find through the demographic data that lower maternal education was indicative of a less likely attempt to breastfeed. The study is limited on the fact that it was used in a suburban Baltimore setting and a non-diverse population at a single hospital. It's also limited based on recall, so the researchers noted that there's a potential for recall bias, and their exclusion criteria was very broad, and it may have excluded more women than is considered the majority, or may have excluded women that were considered the majority, since not every woman seems to have a textbook pregnancy and delivery. This is indicative for the nurses to have a greater role as an educator. So women who are in the hospital, nurses can use that as an opportunity to educate them further about breastfeeding and initiation and other helpful tips for them. And that is it. Thank you so much for your time.